Why does your doctor do so much testing when you have cancer? If you're being treated for cancer, you may sometimes wonder, why do I need so many tests? Didn't we just check this? There's a reason. Actually, there are several. First, we need to know what the cancer is doing. Depending on the type of cancer, that may mean following imaging, tumor markers, circulating cancer cells, or other laboratory findings. And we don't always want to wait for the next scan to start looking for clues. Changes in tumor markers, inflammatory markers, and other laboratory findings may sometimes alert us that something is changing before that change is obvious on imaging. No single number tells us the whole story. We're looking for patterns. Second, we want to know what's happening in the environment in which those cancer cells are living. Cancer doesn't exist independently of the rest of your body. Blood sugar and insulin regulation, inflammation, nutritional status, immune function, hormones, and other aspects of your metabolism can all matter. So we're not interested only in the tumor, we're interested in the person who has the tumor. Third, we need to know what the cancer and its treatment are doing to the rest of you. How are your liver and kidneys functioning? What's happening with your blood counts? Are you becoming anemic? Is inflammation increasing? Is your clotting risk changing? Are you becoming deficient in nutrients your body needs to repair itself? And is your body tolerating treatment as well as we think it is? Sometimes a laboratory abnormality appears before you feel anything wrong. That's exactly when we want to find it. You might also wonder, how often do I really need all of this testing? The answer depends on your situation. With a slow-growing cancer and stable health, some testing may only need to be repeated every 3 to 6 months. With an aggressive or metastatic cancer, or when your overall health is more fragile, we may want to monitor certain things monthly or even weekly. Waiting 3 months can be a long time when the biology of the cancer or the health of the person who has it is changing rapidly. A treatment can stop working, a side effect can develop, blood counts can fall, an organ can begin struggling with treatment before you have any symptoms. I'd much rather discover a problem while it's still small enough to do something about it. And I suspect you would too. If your cancer appears to be moving in the wrong direction, you want to know that before you've spent another 3 or 6 months on a treatment that isn't accomplishing what you hoped. If your liver, kidneys, bone marrow, or the rest of your body aren't tolerating treatment well, you want to know that early too. That gives you and your healthcare team an opportunity to make adjustments, provide additional support, or when necessary, change course completely. So if you're starting to feel like a pincushion from all the blood draws, remember, there's a purpose behind every test. We're using them to answer 3 important questions. What is the cancer doing? What is happening in the environment around the cancer? And how is the rest of your body doing while we fight it? Now, if your oncologist isn't checking all these things, this isn't an invitation to go find a new one. You see, conventional oncology is understandably focused primarily on treating the cancer itself and making sure you can safely receive your treatment. Your oncologist may routinely check your blood counts, kidney and liver function, periodic imaging, and perhaps 1 or more tumor markers. Those are important, but they don't necessarily tell us everything we would like to know about what's going on in the rest of your body. What is happening with your inflammation, your insulin and blood sugar regulation, your nutritional status, your immune function, your clotting tendency? Are there metabolic changes that could be making your internal environment more or less favorable to cancer? And perhaps just as importantly, are those things getting better or worse over time? That's why I believe patients with advanced or aggressive cancers often benefit from more comprehensive and sometimes more frequent monitoring. There's a difference between monitoring your cancer treatment and comprehensively monitoring you. And ideally, you should have both. At Prestige Wellness Institute, we work alongside conventional cancer care to help provide that more comprehensive picture. You can receive the best that modern oncology has to offer while also paying close attention to the health and physiology of the person undergoing the treatment. Because beating cancer matters, but so does protecting the person who's beating it. If that's the kind of approach you're looking for, consider scheduling a consultation with Prestige Wellness Institute. It doesn't have to be one or the other. You can have both.